Why are UTIs persistent due to biofilms? Have you ever wondered why urinary tract infections seem to come back even after treatment? One of the main reasons is something called biofilms. Let's break this down. Biofilms are communities of bacteria that stick together and form a protective layer. They can attach to surfaces in the urinary tract, like the lining of the bladder or even medical devices such as catheters. This protective layer makes it really hard for antibiotics to reach the bacteria and for the immune system to fight them off. When bacteria form biofilms, they create a barrier that keeps them safe from harsh conditions. This means that even if you take antibiotics, they might not be able to penetrate the biofilm effectively. Inside these biofilms, bacteria can also communicate with each other and share information, including how to resist antibiotics. This makes them even tougher to eliminate. In the urinary tract, biofilms can form on the urothelium, which is the lining of the bladder and urethra. They can also develop on prostate stones and are especially common on catheters. Catheter-associated urinary tract infections are a major concern because they often lead to chronic infections that are hard to treat. From a medical standpoint, treating infections caused by biofilms is tricky. Standard antibiotic treatments often do not work well because they cannot fully penetrate the biofilm or kill the dormant bacteria hiding inside. This is why some people experience recurrent infections, even after treatment. Another issue is that bacteria in biofilms can form communities inside bladder cells. This further protects them from antibiotics and the immune system. So, how can we prevent these persistent urinary tract infections? There are several strategies that go beyond just taking antibiotics. For example, using special catheter materials that resist biofilm formation can help. There are also agents that can disrupt biofilms or stop them from forming in the first place. Some researchers are looking into alternative treatments, like bacteriophage therapy, which targets bacteria in biofilms. There is also ongoing work to develop vaccines that can prevent bacteria from sticking and forming biofilms. Understanding how biofilms work is essential for urologists and internal medicine specialists. This knowledge can lead to better prevention and treatment options for patients, especially those with catheters or other urinary tract issues. Addressing both the biofilm and the underlying infection is key to reducing the chances of recurrence and antibiotic resistance.